you in need of general medical services but don't have the insurance to cover the cost? In 2010, Bon Secours Virginia Health System launched Caravan, a mobile service that assists its more than 4,000 residents in Hampton Roads in 2014. Dr. Emily Lieb joins us with more. Dr. Lieb, the idea of having mobile medical services is certainly open to interpretation because we see ambulances and we see a lot of other kind of mobile ways of providing medical care. This, though, does target a certain group of people that otherwise may not seek medical help.
Yes. So the Caravan is it's a primary care office. It's basically a free clinic on wheels.
Wow.
So we travel around to different areas in Hampton Roads, and we are stationary for the day. And anyone who needs the services can walk into the clinic, and we help as many people as we can each day.
Okay. Do you have an average of how many people you might assist in a given day, or does it vary?
Probably average is 20. Sometimes if we have more than one provider, we can see double that, and it depends on the need in that particular location.
Tell me a little bit about the van itself. This is pretty well equipped.
So it is a Winnebago style van, but once you walk inside, it basically looks like you're in a medical office. So there's an exam table, we have EKG, the things that are usually hanging on the wall that you might see in your doctor's office, like the otoscope and things to look in your ears and things like that. So it is basically a medical office, and then at the end of the day, we pack it all up and drive it off.
Wow. So the people that come to see you for a variety of reasons. When you say, general medical services, what does that cover?
So it would be most things that you might go to see your family doctor for. So we are, a primary care clinic. We, once you come to see the Caravan, you're a Caravan patient. So you would take us on and we would be your primary care doctor. So if you already have a primary care doctor, then we would probably encourage you to stay with that person, but there are so many people who don't have that person who's overseeing their care, and they end up in ERs and things like that for things that really are better taken care of in a primary care setting. The main things we help people with are chronic medical diseases, actually, so diabetes, hypertension, asthma, things like that. And sometimes people know that they have these diagnoses, they just haven't been able to get treatment, they haven't been able to afford the medications, and they need somebody who can help them navigate that.
Wow. Yeah, the chronic conditions are things that people will, you need to do something. And this does fill a gap that exists in medical care.
And sometimes the medications are very inexpensive or even free. Some of the medications can be obtained for free, but somebody needs to write the prescription and manage their care, follow them and things like that. So it's really sad when there's somebody who could be managed with a $4 medication or a medication that could even be free to them, and they just don't have access to getting that medication. So that's one of the things that we try to do for people.
You see adults and children, is that correct?
We do. We see more adults than children because we do only see the uninsured. And in Virginia, children have greater access to insurance than adults do. So we have a lot more uninsured adults than we do uninsured children.
On that note, do you help them hook up with some of the children's health insurance?
We do, yeah. We can refer them to places where they can enroll in Medicaid if they qualify.
Okay, good. But of course, getting back to the parent, say if the parent is ill or even may just have a minor medical issue that is keeping them from doing what they need to do to function, it's important to have that looked at early.
Yeah, it is. And even if somebody is healthy, there are just preventive things that are recommended for people. So even if you you don't have any known health problems, there are certain things that you're supposed to just get checked out periodically, and we do that as well. So we also do sports physicals and school physicals for children who need those for enrollment in school.
Okay.
A lot of times when people have just moved to the area and they haven't, their Medicaid enrollment hasn't, taken effect yet, they still need to go to school. So we'll do that for children as well.
Okay, so I would imagine then that August is a pretty busy time of year.
For the kids, yes.
Yeah, because it is anyway. So you say you go two certain sites throughout the Hampton Roads area, and in Norfolk there are 2 sites that you go to regularly?
Three. There's three in Norfolk.
Okay. And what are they?
We have a clinic at Lighthouse Community Church, which is in Ocean View, Mount Gilead Church, which is in the Sewells Point area, and then we have a clinic at the Union Mission, which is on Virginia Beach Boulevard.
Okay, great. And those are they weekly or monthly that they?
Each of those is twice a month.
Okay.
And we go on a regular schedule so that patients can find us. A lot of times our patients don't have internet access, or it's easier for them to just remember, oh well, we know they're going to be at Lighthouse Church on the 2nd and 4th Thursdays of every month, and and we stick to that schedule so that it's easier for the patients.
Okay, so I guess it would be safe to say that you have a lot of regular patients.
We do. We do. If one of our patients does get insurance and they are able to transition to another healthcare setting where there's more resources available to them, that's always wonderful. But as long as they want to stay with us, or as long as they need us, we do maintain that relationship with them.
What about how does this happen? Where do the funds come from to actually make this work?
So it's a service of Bon Secours Health System, and there's a foundation. They have donations from individuals and businesses in the community, and grants and fundraisers, and all these people who think that it's an important service. Come together to fund what we do. Okay, so all kinds of organizations actually put money into it, and the general public is free to do so as well. Sure. Make a donation. Yep. And the patients donate sometimes too. It's not required. The services are free, so anyone who comes can be seen for free. But a lot of the patients want to give something. They want to give a donation, and that's fine.
I imagine that when you have a patient that comes in with something, whether it be minor, or irritating, or what have you, and can at least get a diagnosis and a treatment, that must feel good to them, but I imagine you get a chance to see somebody relieved as well.
It's great. It's great for us. It's great for the team. We really like what we do, and I feel like every day that we are out in the community, we're making a difference for people. So that's a real perk for me.
Great, and it's a real perk for the community too. Thank you, Dr. Lee, for sharing the information about the Caravan, which is through Bon Secours Virginia Medical Health System, and they do come into Norfolk in 3 different locations twice a month, and we hope that you'll take advantage of this if you are in need, or if you know somebody who is, because it does fill a very important need. Regardless of what's going on with health insurance these days, there are people who are uninsured and they need the help. So, thank you. Well, still to come on the forum, if you miss reading books to your kids or grandkids, now's the time to sign up for a program that will leave everyone smiling. Stay with us.